I'd just like to start off by saying that you gave us a long, long list of all kinds of important information today. I'm hoping we're going to see that list in print, and I just want to voice my concern that, these could have been broken up into several news conferences. As far as my question, we're seeing more and more outbreaks in care homes in BC, yet we're being told these care homes have, for the most part, received their boosters. So why aren't they working to prevent outbreaks?
And this is the thing that we are learning from this virus, that it can still spread, particularly in people who don't have a strong immune response. And so that is why it is so important to get those booster doses in there. We also know that it can come in unvaccinated healthcare workers, which is one of the reasons why we've put those measures in place as well. So we are continuing to see small outbreaks, mostly small outbreaks, and I think that's important. We have a very sensitive definition. As soon as we see a single case, we do increase testing and monitoring. And what that does lead to is identifying many people who maybe have very, very mild symptoms or be asymptomatic. And so we do include all of those cases as we monitor these, but we are hopeful that with the booster dose and with the measures that we've taken around healthcare workers and visitors, that we'll start to see that come down as well. But it just reminds us this virus can be vicious when it gets into those very high-risk settings. And despite the effectiveness of vaccination, we still have to take additional precautions to protect those seniors and elders in those settings.
Lisa, do you have a follow-up?
Yes, thank you. So does this mean that your booster program started too late? And, what responsibility do you take for these outbreaks?
Yeah, so I don't believe our booster program started late. We waited for the data that we had that showed what the optimal interval was. And as you know, very early on, we extended the interval between dose 1 and dose 2 in most of our long-term care homes, which is different from some other jurisdictions, including other jurisdictions here in Canada. So as we started to see increases in the community, we start to see spillover into long-term care. And we saw that in the summer, immediately after many of our long-term care homes had received their second doses. So it just reminds us of how important it is for all of us to be vaccinated, to have our best protection, but also to take additional precautions in settings like this where this virus can transmit very easily, particularly the strain that we're seeing now, this Delta strain. And I've said this many times over the last few weeks. It is a different game now. We are seeing transmission that's much more rapid. We are seeing more severe illness in younger people who are unvaccinated. And although we are seeing some breakthrough in older people, particularly who were immunized early, it is mostly a milder illness if you're vaccinated. So that is the best protection that we have.